So I'm usually the warm-up act for the headliner, Ray Fabius. We typically travel in pairs together and tell our stories. So one of those graphs that Ray shared is a study that I'm the lead author on, which also will appear in the Journal of Occupational Environmental Medicine in January. And that's a portfolio of the winners of the C. Everett Koop Award. So one of my jobs, besides being a senior scientist at Johns Hopkins and also a vice president for consulting and applied research at Truven Health Analytics, is I'm the president CEO of the Health Project, which annually awards companies the Koop Award if they can demonstrate with data that their health promotion programs have improved health and saved money. So we have created a portfolio of 26 companies that have won the Koop Award since 1999 and did the same thing that Ray just talked about, which is to compare that portfolio to the S&P 500. And Ray has already let the cat out of the bag here. Those companies did outperform the S&P 500 significantly. And I think these studies, when they come out together in the next month or so, hopefully will get the attention of the investor community, that they need to pay attention to health and safety programs in these corporations. So I've been doing research in the area of workplace health promotion for about 30 years. I'm a true believer that charity starts at the home, that you've got to eat your own dog food before you go out and sell it to other people. And shared accountability and shared value really starts by showing that you care about the health and well-being of your workers. So I've done a lot of studies, looked at the health and well-being of these companies and also the financial impact and return on investment. And here's the conclusion. Workplace health promotion programs don't work. Here's another conclusion. Workplace health promotion programs do work. They work remarkably well. How can I say these two things together? There are a lot of programs out there that are awful, that are lousy, that are actually very superficial and may even cause more harm than good. On the other hand, there are programs like the winners of the Koop Award that are magnificent programs. They have all the elements for success, and they are successful. They actually have the data to show that they are successful at improving population health and saving money. And recently, what I've done is try to get the word out, to disseminate what those best practices are, is that secret sauce that makes those companies successful. I want to spend a little bit of time talking about those ingredients. In fact, we know quite a bit about what works in worksite health promotion. We published a systematic review out of the Community Guide to Preventive Services back in 2010. Robin Soler was the lead author on that review, where we looked at 86 different studies, looked at their performance, looked at their impact on behavioral risk factors, biometric risk factors, but also healthcare use and productivity, and found that there was sufficient or strong evidence that when designed properly and properly implemented, these programs can actually have a positive impact. So the trick now is to let the business world, 95% of the companies out there in America who want to do good for their workers, but don't know how to do it. So what are these best practices? We've spent time now over the last year or two disseminating best practices through these various vehicles. I'm going to mention them very briefly, and then I'll tell you what we've distilled to be the secret sauce of those ingredients, the 10 ingredients that comprise best practices. One of the most interesting and important work and fun work that we've done, supported by the Rodwood Johnson Foundation, was to go out and study what these best practice companies look like. So we did literature reviews, we convened panels of experts, then we went out, in some cases with camera crews, to look at those companies, 9 companies that are exemplary in terms of promoting healthy workplaces. Here are the case studies that we focused attention on. Some of them are large companies mentioned already, like Johnson & Johnson and Dell Computer, well, they're not here, Citibank and Graco and USAA. But some are actually very small companies. A small company in New York City called NextJump, 200 employees, software engineers, $2 billion in annual revenues. And they have created a wonderful culture of health within their organization. We've also done work with Transamerica Center for Health Studies. What they came to us and they said, well, we have a lot of small businesses in America, and they essentially want a cookbook, a how-to guide. How do you put these kinds of programs in place? But all of the recommendations that you offer have to be evidence-based. So we provided this cookbook, From Evidence to Practice, Workplace Wellness That Works, that focuses not just on individual risk factors, but also organizational risk factors. We worked with the American Heart Association in creating an employer playbook. So this is a website that they now have where, again, you can go there and say, well, I want to focus on cholesterol. I want to focus on tobacco, on physical activity, on organizational health. How do I do that? And what's the evidence supporting that? Interactive website. Now, the nice thing is the CDC has finally gotten a little bit of money from the Prevention Fund to focus on workplace health promotion programs. So there are several initiatives underway right now, including this one, Workplace Health Research Network, which has brought together several universities and their experts, their scientists focus on total worker health and doing studies and research to get the word out on best practices and to take what's already known and already published in systematic reviews and getting them out to the employer community. So what is that secret sauce? And of course, the challenge here is to distill it into kind of these 10 ingredients for creating healthy cultures and healthy workplaces. Number one, create a culture of health, which means that you have more than just a wellness program. It's a way of life. This is how the organization sees itself and communicates itself to its workers and to the outside world. It's ingrained in every aspect of the organization, its mission statement, its built environment, performance metrics, programs, policies, and health benefits. Leadership commitment. Mark mentioned this earlier. It has to be CEO driven. CEO has to believe it, but it has to then be disseminated and communicated by middle managers, your supervisors, the people who give you permission to lead a healthy lifestyle. There needs to be a budget, there needs to be a business plan, an annual report, and empowerment of workers and unions so that they feel and they become part of the solution. Number three, specific goals and expectations. This is a quote from Johnson & Johnson, think big, start small, act fast, one step at a time. Setting short and long-term objectives, and what that means is, yeah, you've got to think about what you want to achieve in 1 year, but what about 3 years, 5 years, 10 plus years? And a great deal of accountability needs to be in place where leaders and employees are accountable for doing their part to support a culture of health. And in fact, in some companies like Dow Chemical, managers' bonuses are tied to the improvement in the health and human performance of their workforce. Strategic communication. This is a term that Peter Wald from USAA is talking about, which is surround sound. Wherever you go within the company, you are surrounded by messages to be healthy and facilitators for a healthy lifestyle. Those messages need to be consistent, constant, engaging, targeted, two-way communication, dialogue, so that employees have a chance to get back to the people who are designing these programs, and importantly, wellness champions. These are people within the workforce who are really committed and supportive of health promotion, and they're your local ambassadors for health improvement programs. Number five, employee engagement and program design implementation. An important point made earlier that you've got to understand your customers. You can't sell stuff if the customer base doesn't want it. So you've got to go out and find out what your employees want. Do they want yoga or do they want fitness centers? Do they want stress management? Do they want nutrition programs? You need to understand what they want and then custom and tailor those programs to the employee needs and wants through wellness committees, feedback surveys, focus groups, all kinds of ways to get employees to own the program that you have. There's best practice interventions. There's actually a science base out there for the last 20 years on how to change human behavior. Work by Prochaska, by Vic Straker, by Kate Lorig, Bandura. These are the people who have been studying behavior change and organizational change for many years. They know very well that just handing somebody a brochure to change behavior won't work. There are systems, there are practices, and that's what needs to be put into place. A lot of choices. You've got to give people a lot of choices in terms of things that are important to them, making the healthy choice the easy choice, and that's essentially product placement within the workplace, and applying behavior change theory. 7, effective screening and triage. A lot of controversy about how often you probe people and you take their blood and you apply various screening programs to them. Recommendation is typically to follow the guidelines from the U.S. Preventive Services Task Force, have health risk assessments, have follow-ups, but you've got to do more than that because that alone actually has not been shown to influence health at the population level. And sometimes you need on-site clinics and counselors. Incentives is another area of controversy. A lot of employers found that the Affordable Care Act now gives them an opportunity to provide different insurance premiums for people who are participating in these programs and or achieving certain healthy outcomes, but that's not enough. Telling somebody we're going to give you a lower insurance rate or we're going to give you money if you reach a certain BMI doesn't work for somebody with a BMI of 45. So what these incentive programs need to be tailored, alternative paths to motivate, reward, and help employees achieve their goals, tiered incentive programs so you get rewarded at each stage of improvement, non-monetary incentives. Some of the most successful programs out there are those that actually don't have dollars attached to them, but have things like a lunch with the CEO. Carrots work, sticks do not work. They stoke resentment on the part of the employee population, and most importantly, these need to be voluntary so that there aren't huge dollar amounts associated with participation or achieving certain outcomes. Number 9, effective implementation, tailored to the company's culture, integrated solutions, flexibility, fresh ideas, and something we're finding more and more of, which is making this fun. Don't focus on morbidity, mortality, focus on having a healthy, energized lifestyle and having fun in the workplace. Finally, common denominator to all these successful programs is measurement and evaluation. And where this starts is by getting all the significant people in the organization around a table and asking them what's important to you. What do you see as the most important accomplishment for this program? And you're going to find, by the way, a great diversity of opinion. People can say, well, I want high participation and engagement. I want people to lose weight, exercise more. Our medical claims should go down. Our absenteeism should go down. Attract and retain the best talent. So forth and so on. You've got to make sure you understand what their goals are and the metrics associated with those outcomes of interest to that organization. This is just a diagram of a logic model developed by the community guide at the CDC, basically emphasizing the need to measure the structure of the program and its interventions that are focused both at an individuals and the organization as the patient, the process, the way in which these programs are being delivered, and finally, the different set of outcomes. These need to be aligned. You have to have good structural measures, good process measures, and good outcome measures. So my final slide is that workplace health promotion programs can work if you do them right. If you follow these best practices, the secret sauce that I just alluded to, that can lead to positive financial outcomes internally as well as externally, in terms of reduced medical costs, absenteeism, short-term disability, workers' comp, safety, and presenteeism, which is on-the-job engagement, people who are there and they're fully focused on their work. It has to be tied to health outcomes, and what that means is adherence to evidence-based medicine, behavior change, risk reduction, and health improvement at the population level, not just at the patient level. And then finally, the things that we're really concerned about, which is humanistic outcomes. Improvement in the quality of life of workers, their productivity, attraction and retention of the right workforce, employee engagement, aligning with corporate social responsibility, having balanced scorecard, and shared values. Thank you.